Sir, can you tell me your name?
Derek Bass.
How old are you, Derek?
18.
Do you realize I'm going to be videotaping this assessment to submit for a grade at Edison State College? It'll be viewed by the instructor, possibly other members of the nursing school, and may be kept on file as part of the accreditation for Edison State College.
Yes, sir.
Do I have your permission to videotape this assessment?
Yes, sir.
Very well. How you doing, sir? My name's Chris. I'm going to be a nurse today. We're going to go through an assessment, okay? What I'm going to do is you're going to feel me feeling all over your body. We're going to start at your head and kind of work our way down. Maybe sometimes I've got to listen to you, and sometimes I've got to feel different parts of your body. We'll have to ask some questions. Some of them might be personal. I need you to just answer as truthfully as possible, and we'll get through this as quickly and painlessly as possible. Do you have any questions for me?
No, sir.
Okay. Very well. Do you know where you are today?
Yes, sir.
Where's that?
Your house.
What year is it?
2013.
Who's the president right now?
President Obama.
Very good. At this point, when the patient came in, we would have gotten his vital signs. I've got blood pressure in the right arm and the left arm. I'm going to feel your pulses. Your pulses are equal. They're strong. Rate appears to be right where it should be. We would compare the blood pressure in both arms to make sure that they were roughly the same where they should be. Any differences could be signs of cardiovascular disease or other problems going on that we would have to look further into. Okay? Have you been feeling well?
Yes, sir.
You hadn't had any complaints? Just here for a well visit? No
Yes, sir.
problems?
Yes, sir.
Very good. I'm going to take a look at your head, okay? And feel your hair here. The hair feels soft. It's full. There's no signs of baldness, no signs of hair loss at all. It's not brittle. I'm looking at your skin. Your skin appears to be warm to the touch. It's normal turgor. There's no signs of tenting, no signs of dehydration right now. There's a couple of acne lesions in your upper chest and your arms. Other than that, your skin appears to be intact. Can I see your hands? I just want to see a finger. Squeeze your fingers here. The capillary refill is less than 2 seconds. I'm looking at your nail beds also. Your nails are symmetrical. There's no signs of clubbing or widening of the nail. Those are all signs of pulmonary disease and problems breathing. You're young, we don't have those problems yet.
Correct.
Don't smoke, you won't have those problems. We'll all be good. There's no signs of jaundice. His skin is pink. No, you don't have any rash. You haven't had any problems with itchy skin or dry skin. Nothing like that?
No, sir.
Very good. Alright, I'm going to do a couple of tests on you. I just want you to follow what I tell you to do, okay? Can you smile real big for me? Very good. How about raise your eyebrows? You can stop smiling. You're scared. Can you close your eyes real tight? Squint them as tight as you can. Tight, 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 tight. Very good. I'm going to have you open your mouth here. Close it. All right, no problem. Can you stick your tongue out? Move it from side to side? Up and down? No pain, no problems there whatsoever? Okay. I'm going to have you follow this pen with your eyes. Don't move your head at all, okay? All extraocular movements are intact. You're going to see me shine a little light in your eyes, okay? Just testing your pupil response. Pupils around equal, react to light, they accommodate well. Their size is about 4 millimeters right now. Have you had any visual disturbances or visual problems that you know of?
No, sir.
Can you see just fine? You can read at a normal distance. You don't have to get really close or really far from objects. Can you read objects very far away
Yes,
when
sir.
you're driving? You don't wear glasses or contacts normally?
No, sir.
Okay. At this point, we would also assess for color blindness. If we had a color blind chart, we would ask them to look for red and green color blindness. We would also do a visual acuity in the right eye, the left eye, and then both eyes. Compare to make sure that they're roughly the same and where they should be, and that there's no visual loss that we can tell. I'm going to take a look at your ears real quick, okay? Can you hear okay? You don't have any problems hearing?
No, sir.
Can you hear if people are talking to you from across the room, even if they're whispering in a low voice?
Yes, sir.
Okay. You don't feel like people are always making you repeat stuff or anything like that? That's very good. Do you have any ringing in your ears?
No, sir.
Any odd sounds that you hear that Don't appear to be coming from anywhere?
No, sir.
Okay. Just going to take a look at your ear. Ears are symmetrical. They appear to be at the right height. There's no signs of lesions. There's absolutely no drainage noted in the ears. Patient does not report any hearing loss or hearing problems. I'm going to take a look at your nose real quick, okay? Nose, good color. There's no drainage noted. It does not appear to be congested. I'm going to shine a light up there really quickly. Do you have any problems with seasonal allergies or being outside and being congested after being outside at all?
No, sir.
Okay. I'm going to feel up on your head here. No problems at all? You don't feel any pain when I do this?
No, sir.
Okay, very good. I'm going to move over to your neck. I'm just going to feel the back of your neck. It appears intact. The spine is midline. Feel your lymph nodes. They do not feel enlarged. Any enlarged lymph nodes would be a sign of infection, so that's what we don't want to see, okay? Can you turn your head from side to side? How about put your chin all the way to your chest? Does that cause you any pain?
No, sir.
Do you have any problems doing that whatsoever?
No, sir.
Very good. Alright, at this point I'm going to listen to your chest and take a look at your chest. I'm also going to be feeling on your chest, okay? We're going to stay to your upper chest for this point, okay? Can you take a deep breath for me? Very good. And out. Chest has equal symmetrical rise. His body hair is equal. There's no signs of hair loss or brittleness in his body hair. He does not appear to be using any accessory muscles for his work of breathing. Do you have any problems breathing? Any respiratory problems at all?
No, sir.
Very good. I'm going to take a listen to your lungs, okay? Just take a deep breath for me. And out. In. And out. Okay. Again. And out. Okay, I'm going to come over to your side and listen here. Okay. Patient's lung sounds are clear and equal. He does have appropriate bronchial, vesicular, and bronchial lung sounds in the appropriate places. And I'm going to come down. I'm going to take a look at your belly here for just a minute. Okay. I'm also going to listen to your belly real quick to see, just to make sure that your bowel sounds are normal and I can hear everything that's supposed to be there. Okay. You just lay still and be quiet for just a minute. The patient does have good bowel sounds in all four quadrants. I'm looking at his belly. There does not appear to be any problems with it. I'm going to feel on your belly here and just push down, okay? Any problems? Any pain?
No, sir.
Pain?
No, sir.
No problems?
No, sir.
Abdomen is soft, non-tender, it's non-distended. When listening to breath sounds, I use a master cardiology stethoscope, so I do not have a bell, but it is tunable by pressing harder and lower to hear the different breath sounds. Alright, you're going to feel me just kind of beat on my finger here. I'm going to be pushing a little bit on your abdomen, okay? There's no hyperresonance noted in the abdomen. Abdomen sounds normal, sounds good. No belly problems, you haven't been vomiting, pain, or anything like that there?
No, sir.
Okay, very well. I'm going to listen to one more thing on you. I'm just going to listen to your arteries, basically, your renal arteries, and then your pulse. You just breathe normally for me, okay?
Yes, sir. Aorta, renal arteries, all sound well.
I'm going to listen again, one more time, to your heart sounds this time, okay? Good, S1, S2, that's what we want to hear. You don't have any signs of murmur or gallop or any extra heartbeats in there that shouldn't be there. S1, S2 sounds are heard in all spots. There's no signs of rubbing or anything like that. Your heart sounds are very well. Patient does not appear to be obese at all. Have you had any type of cough or anything recently?
No, sir.
Okay. Can you been coughing anything up, any sputum or mucus production that's abnormal for you?
No, sir.
You don't wake up in the morning coughing?
No, sir.
Okay, very good. Alright, I'm going to move down here to your legs, okay? I'm going to uncover just the right leg for now. No problems in your legs at all?
No.
Can you bend your knee up? Okay, you can put it down. Can you bend your feet, wiggle your toes? No problems there?
No, sir.
Alright, I'm just going to come up under your leg here. Just relax it. You're going to feel me. I'm just testing your reflexes, okay? Okay. I'm going to uncover your other leg here for just another minute. Get good pedal pulses. Posterior tibial pulses. And good popliteal pulses. They're all equal, strong. Alright, at this point we would have the patient be undressed. We would inspect the genitalia for any signs of lesions or drainage. Any urinary problems? No burning when you pee? You don't have difficulty start peeing? No frequency, feeling like you have to go more often than normal or anything like that?
No, sir.
Very good. Alright, I'm going to have you sit up for me. You can just have a seat right here on the edge of the bed. Okay. I'm going to listen one more time to your lungs. This time I'm going to listen to the front and the back, okay? Deep breath for me. Very good. In. And out. In. Out. Very good bronchial vesicular breath sounds. Want to come over here and listen? Vesicular breath sounds, clear, equal. Bilaterally. Okay, I'm going to listen to your back, okay? Another deep breath. Again. 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 One more. And again. Okay, breath sounds are equal in all areas. Chest rise is symmetrical. You're going to feel me feeling back here just at your, kind of where your spine meets your rib cage there, okay? That's called your costovertebral angle. And you're going to feel me pounding on it for just a minute, okay? Let me know if you feel any pain. Okay?
Yes, sir.
How about on this side?
Good.
No pain at all?
No, sir.
Very good. That's what we want to see. Okay. I want you to put your hands out. Squeeze my hands for me. Squeeze them tight, tight, tight. Very good. Put your arms straight out in front of you. I want you to hold them up. Don't let me press them down. Okay. I'm going to push up. Don't let me press up. Very good. Here's equal grip strength. Arm strength is equal. Can you shrug your shoulders for me? No problems. All muscles appear intact there. I'm going to come and feel along your muscles here. No pain. Okay. Can you kind of squint your face up like that? Very good. I'm going to look at your neck here. Your trachea up here, midline. There's no tracheal shift or deviation noted. Looking at your back, your spine appears symmetrical. It's straight. There's no abnormal curvature that we would not want to see, such as in scoliosis. Your posture is very well. You don't appear to have any slouching or postural issues. Can I see one of your hands? Okay. I want you to make it a fist real tight. I'm just going to squeeze your hands, okay? Turn your arm over so I can see you. There you go. I'm going to squeeze. I'm going to kind of occlude these arteries here. This is called a modified Allen test. It's going to just assess your arterial circulation, okay? Can you open your hand up? Okay. Color returns within about 3 seconds. Very good. All right, can I get you to come right over here and just stand up for me for a minute? Okay. I want you to put your feet at your side. Feet together, I'm sorry. Arms at your side. Look straight ahead at me. All right, I want you to close your eyes. Okay, I'm standing alongside you just in case here. No problems? You feel dizzy?
No, sir.
Okay. There's no movement noted with the Romberg test whatsoever. You can have a seat back on the bed if you would, sir. Do you have any health issues that you'd like to discuss today while you're here?
No, sir.
Okay. You haven't had any problems that you're worried about? Nothing that we should talk to the doctor about whatsoever?
No, sir.
Okay. I'm going to do a couple more tests just on your chest here, okay? I'm going to put my hands crossed. I want you to say 99.
99.
99.
99.
Okay, no tactile firmness is noted. Let's see. Now, one more thing I want to look at. We're just going to look at your mouth, okay? You don't have any. Do you have any dentures at all?
No, sir.
Okay. Open your mouth real wide. Smile. Any problems with your teeth? Any loose teeth?
No, sir.
Any pain with teeth?
No, sir.
Can you kind of show me your gums? The gums are pink. There's no signs of gum disease there. No swelling. Do you have any bleeding when you...
No, sir.
Okay. I want you to do one more thing. I want you to stick your tongue out. I'm going to shine a light in there. I want you to say ah. Ah. Very good. Uvula is midline. Tonsils do not appear to be inflamed. I would grade them at a 0 right now. Do you have any throat pain?
No, sir.
Difficulty swallowing?
No, sir.
Your voice hoarse at all sometimes?
No, sir.
Okay, very good. Alright, one last thing we're going to go over. Do you do testicular self-exams?
Not. Never before.
Okay. Are you familiar with what that is?
Yes, sir.
Okay. You're testing for signs of cancer. Just like women have to do breast self-exams, guys should be doing testicular exams. You should do this on a regular basis. You can do it when you're in the shower. What you're going to do, you need both 2 fingers, and you're going to feel each of your testicles. You want to feel that they're round and that there's no lesions. You're going to kind of squeeze, palpate all around there gently. It should not cause you any pain. You shouldn't feel any bumps, okay? If you feel any bumps or anything that feels abnormal from the last time, that's something you need to see your doctor about. Guys can get testicular cancer at very young ages. It's very treatable if it's caught early, but the only way you're going to catch it early is to do regular self-testicular exams, okay? Should be done once a month, just in the shower, okay?
Yes, sir.
Any questions at all for me?
No, sir.
Okay. Thank you for your participation and your help.